Are you stressed?
Now calm down.
You're not alone. Unfortunately, everyone is stressed, even our children. As a doctor, I see the harmful physical effects of mental stress, from heart attacks
I think I'm having a heart attack.
to strokes to urinary tract infections and pneumonias.
Yes, I have laryngitis.
Life is more stressful than ever. And in this video, I'm going to talk about a simple, affordable pocket device that you can use as a tool to help you control your stress. And I'll teach you how to use it. This is a pulse oximeter. This shows your heart rate and how much oxygen you are getting in your body. This device is under $20 and it can help you master your stress and be on top of the inflammation before it happens. Now I'm going to describe 2 techniques that you can do today to calm your stress, slow down your heart rate, and decrease inflammation to help you relax. Now, if you have a pulse oximeter, go grab it. You'll be able to objectively see your heart rate going down and your oxygen saturation going up. And if you have a fancy iWatch or fitness tracker, you have that function as well. But if you're on a budget, you don't need to get a fancy fitness tracker. This works just fine. And this is actually what medical doctors use. Warning, you're supposed to put your finger in here. So if you have acrylic nails or nail polish, it's not going to work. The fitness tracker will be better. But if you have darker skin, you may struggle to get an accurate reading. So you may have to take your device to your healthcare provider, like bring it to a nurse appointment to get some personal help to how to use it for accuracy. And it's important that you make sure it's accurate because it can really help you mitigate a lot of health issues, which I'll talk about in my future videos. So if you're next to a bed or sofa, simply lying flat on your stomach, you will mitigate your stress. You'll be able to calm your heart rate, improve your oxygen, and feel more relaxed. Of course, don't do this after eating. This is what I call the Garfield posture. Remember Garfield, the cartoon cat? He's a master at chilling out. The medical term for this posture is proning, and I recommend anyone who is struggling with a viral respiratory illness to try this, except for infants. But for many inflammatory conditions, including people who are intubated on a ventilator, people with reactive airway disease, this works by calming inflammation, and we do this all the time in the hospital. You get better gas exchange, and you can do this posture on the floor, in the backseat of your car. Really, it's just terrific. It's a terrific tool. And here's why it works. Your body can't tell the difference between mental and physical stress. They both cause the same hormonal and neurological changes. Now, if you've been physically sick, like with a cold, you've experienced the very normal immediate feelings of loss of appetite, nausea, dry mouth, cold and clammy skin, racing heartbeat, and mentally irritable. And this is because you've activated your unconscious sympathetic nervous system. If the stress continues, you kind of get used to those changes. It becomes normal, kind of like background noise. But that continuous inflammation is actually harmful. It'll thin, dry up, and wrinkle your skin. And if this happens to the skin of your gut, you're going to develop ulcers and bleed. Conscious mental stress also activates your unconscious sympathetic nervous system to cause all the same damaging physical changes because the same stress hormones like adrenaline and cortisol are increased. In the short term, this is actually good. It's a survival tactic because it prepares you to escape and run from danger, funneling your blood to your brain and your muscles and away from your skin and gut, because you don't need to eat and look pretty when you're dodging flying bullets or running from a mountain lion. But the problem arises that when your body feels this stress all the time and it doesn't go away, and that unconscious sympathetic nervous system is activated and doesn't shut off, it's like a house guest who overstays their welcome. What was initially good now becomes burdensome and destructive. So of course, the best way to reduce your stress is to remove the stressor, which isn't always possible. If your job gives you stress, you can change jobs, but that may take some time.
I'm telling you, I'm quitting. That's it. I'm talking to my boss right now.
If your family gives you stress, you can't actually change families, but you can try to calm your reaction by calming your unconscious nervous system. And proning is one of several ways to adapt to stress so it isn't as physically harmful to your health. And this is critical because mental stress translates into physical damage to your body. It reduces blood flow, it raises your blood pressure, it suppresses your immune system, it interferes with your digestion, with your sleep, with your hormones. There's countless other things that are harmful to your health. Basically, basically it causes total body chronic inflammation, suppressing your immune system, setting you up for metabolic diseases like diabetes and high blood pressure. And there are countless markers of inflammation, and you can find a doctor to measure stress markers every day in your blood, testing hormones or inflammatory markers. But unless you're super sick, it's going to be a waste of your blood and a waste of your money. It turns out you can measure your inflammation without donating a drop of blood, just by measuring your vital signs. And if you've ever been to a medical doctor ever in your life, you would have had your heart rate and oxygen saturation checked. And any doctor who doesn't check those numbers, they're not optimizing your health. But the secret is you don't need a doctor to get one of these. You can buy these online on Amazon and learn to use it yourself. This little gadget, the pulse oximeter, can measure your heart rate and oxygen saturation. And these numbers are so important in the hospital that we stick a continuous pulse oximeter on your body, measuring these changes 24/7. Now, a normal resting heart rate is up to 100 beats per minute, but if you talk to exercise physiologists, they really believe a normal resting heart rate for fitness is really below 75. So your heart is stressed, maybe from your diet, from your lack of fitness, from your lack of exercise, or something else, which can be mental stress. So when you're relaxed, you have less mental stress and you'll have less physical stress. Your heart rate will be lower and your oxygen will be higher, less metabolic stress. Inflammation elevates your heart rate and lowers your oxygen, even silent inflammation. Now, if your heart rate is low due to medications like a beta blocker for your cardiovascular disease, then you may not have these changes, and the lack of change really won't be a reflection of your fight against silent inflammation. If you are taking a beta blocker, you are getting treated for stress. Just know it comes with side effects like impotence and reactive airway disease. But don't just stop your medications, consult your prescriber first. Now, you'll look pretty silly if you just drop through the floor every time you're stressed. So proning is not practical when you're in public. Option 2 is to learn how to control your breathing. When you're anxious, you hyperventilate, which makes you even more anxious because shallow breath makes you retain more carbon dioxide, which makes your pH lower. It acidifies your blood, causing you more stress. And I see this all the time in patients in the hospital who are struggling with oxygen, people who struggle with obstructive sleep apnea or obstructive lung diseases of other kinds, or being simply sedated by narcotics. When your pH goes down, you get moody, you get irritable, you can pass out. And this just makes you sleepy and tired. So people who can't breathe well, especially people who have some kind of lung obstruction, will be more moody. And when you're moody, you're unmotivated, you have no energy, and then you can't correct the problem unless you lose weight or have a breathing machine. And so this is why maintaining your normal pH helps your brain and body to perk up. Getting rid of your carbon dioxide helps you to relax. And this you achieve by exhaling longer than your inhale. Basically, you want to take a deep sigh and breathe twice as long out as you breathe in. And this simple technique allows your heart to calm down, and it calms your sympathetic nervous system. Now, the best way to do this is to first take 2 quick back-to-back breaths in to expand your lungs, and then blow it out with a long sigh to get rid of your carbon dioxide. A general rule is like a 4-second breath in and an 8-second breath out. This breathing technique also stops those negative, stressful thoughts. And of course, this is temporary, because unless you can fix the root cause of your stress, you'll still have the stress. But if you can make it a habit and change how you respond to the stress, then you'll definitely be able to deal with it better. And by using this breathing technique, you can refresh your mind to help you problem solve, to maybe avoid these stressful episodes. And in the beginning, you really don't want to do more than 3 repetitive breaths in a row, because then you may feel lightheaded. And the pulse oximeter will help you mitigate, right? It may even help you mitigate that stress before it comes on, because when you check it, you'll notice your heart rate goes up or your oxygen is lower. You know, if your pulse is above 75 or if your oxygen isn't at 100, then you know you can do some of these exercises and improve your numbers. And when you improve your numbers, you're going to help your stress. And this is just one of many tools that you can use to incorporate in your daily life to improve your health. And when you learn to do it, teach it. Show your kids, show your parents, show your siblings, show your friends and coworkers. I hope this video was helpful. If you like this video, please join me on my next video for more helpful tips. See you there.